In an unprecedented move this week, Governor Laura Kelly canceled school for the remainder of the semester for all Kansas schools. This falls on the heels of Butler Community College extending spring break for 1 week and canceling on-campus classes for the rest of the semester. Students will resume classes in 2 weeks online. I spoke to Butler County Emergency Management Director Keri Korthals to find out what her department is doing in response to this growing pandemic.
I can tell you that it was not a community spread, so it was travel related. So it was something that got brought back into the county. So it's not something they contracted just being out and about in the communities. So at this point, we don't have any evidence that it's loose, for lack of a better phrase, that it's loose in our community. That was a travel related exposure. From what we were told, that person took precautions really quickly to limit contacts. So when the health department did their contact tracing, they really didn't find a high number of exposures, and they were able to identify really quickly where those contacts were. So any fear in the community of, oh, I might have been exposed to that person and not know it, those risks seem to be really, really low. It seems like this case was very quickly identified and very quickly contained, which hopefully will put a lot of minds at rest. This is in our lower level activations when we do need to bring a few heads together, we do need to work on strategizing some things. This is our, I guess you could kind of say, our mini operations center, but it is kind of our situational awareness hub of where we kind of keep track of what's going on. The need may arise at some point where we need to have people in here staffed round the clock, or maybe at least during business hours, maybe taking resource requests, fielding phone calls, getting all the heads together to strategize. But right now we're pretty much doing that from our own respective stations. Because this isn't the time we want to pack a whole lot of people into a room anyways. Because we don't want to wait to prepare until it's widespread. So while we don't want to panic either and think, oh my goodness, the sky is falling and this is going to be running rampant through the county, we also don't want to sit back and say, we've had one case, why should we do anything about it now? Because then we're really behind the 8 ball if things do start to get, say, a community spread in Butler County. If we wait until that moment to say, well, now we should start thinking about what are we going to do with continuing government operations? What are we going to do with transporting these patients? What are we going to do with getting supplies to our elderly? If we don't do anything until we have a problem, that's the wrong time to do it. So
yeah, and I love the map there of Johns Hopkins, because you can go into that country and you can really zoom in and you can see where the pockets were and you can see areas that had none. And that's where we're learning, those mass gatherings is where a lot of the high majority of the illness was happening. And so that's why, okay, let's go ahead and let's start limiting the mass gatherings. What else can we do? Okay, well, let's look at schools because of all the kids and the mass gatherings.
We don't really have the excuse because we've seen it happen in all these other areas. We've seen the spread in China. We've seen the spread in Italy. We've seen the spread in Iran. And for us to sit back and say, oh, it caught us by surprise that would not be the appropriate response.
Sure.
Because we did have that benefit of seeing others go through it first. And sure, our situation and our setting is going to be different than China. We're going to be dealing with a whole different population mix, a whole different infrastructure, a whole different response system. So, our track of the virus, our path of the virus may not look anything like China's. But again, we can't say we didn't see it coming. So.
And we watch what's happening. And we don't want to wait till what's happening on the East and West Coast hits here because we know it comes in. We want to, okay, how can we not have this, huge spike happen to us? Washing the hands, covering the sneezes and coughs, stay home if you're sick, and don't panic. Stay calm, take some deep breaths, and just be prepared.
So be sure to practice safe social distancing, wash your hands, use sanitizer, and stay safe. From the heart of Butler Emergency Management, I'm Deanna Bond.